Over the past 24 hours, the president has continued to improve. He's met or exceeded all standard hospital discharge criteria. He'll receive another dose of remdesivir here today, and then we plan to get him home. It's been more than 72 hours since his last fever. Oxygen levels, including ambulatory saturations and his work of breathing, are all normal. Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home, where he'll be surrounded by world-class medical care 24/7. I'd like to bring Dr. Dooley up to review some more specifics.
Good afternoon. Just a brief update this morning. As Dr. Connolly mentioned, the president continues to do very well. His vital signs this morning were notable for a temperature of 98.1. His blood pressure was 134/78. The respiratory rate of 17 respirations per minute. His heart rate was 68 beats per minute. And his last oxyhemoglobin saturation was 97% on room air. He currently does not endorse any respiratory complaints. And aside from our evaluation with the multidisciplinary team this morning, has maintained a full schedule, ambulating and working on the White House Medical Unit. I'll now turn it over to Dr. Garibaldi to again discuss therapeutics. Thanks.
Hi, good afternoon. And again, I just wanted to echo the sentiment of what an honor it is to be part of this wonderful team here at Walter Reed. Yesterday evening, the president received his third dose of remdesivir. He tolerated that infusion without difficulty, and his kidney and liver function continued to be normal. Our plan is to give the fourth dose of remdesivir this evening before he goes back to the White House, and we've made arrangements to deliver the fifth and final dose of his treatment course at the White House tomorrow evening. He continues on dexamethasone, and again, the plan for today is to continue to be up and out of bed, eat and drink, and work as he is able. And I'd like to turn it over to Dr. Jason Blaylock, who's an infectious disease specialist and the chief of medicine here at Walter Reed, to give some updates on infection control. Thank you.
Good afternoon, everyone. First of all, I just want to say what an honor it's been to be part of this medical team behind me and to care for the president. Since the president's arrival at Walter Reed, he's received medical management that remains in line with national clinical societal guidelines for treatment of COVID-19 infection. In addition, both myself and Dr. Wes Campbell have worked very closely with various laboratories in the area, state-of-the-art facilities to include USAMRIID and RARE on obtaining advanced diagnostic testing to really inform the White House medical team of both the status of the president as well as his ability to transmit virus to others. Also, we have worked very closely with the Walter Reed team to ensure that we are looking very closely at infection control prevention strategies and the right posture so that the president can safely return to his residence. And with that, I'm going to turn it over to Dr. Conley, who will answer any final questions.
I mentioned it Saturday, but I'd like to reiterate myself just how grateful the president and I are to the men and women of Walter Reed, our colleagues at Johns Hopkins, as well as the many federal, private institutions that we receive support from. And so long as everything continues on the track that we're experiencing right now, this time, as the president already tweeted out, is to get him home later today. With that, I'll take a couple questions.
Discharged back to the White House when he was given steroids. You've said that he's still on those steroids. Those are medicines, as you know, that are usually given to COVID patients who are on ventilators or with low oxygen. So did you overtreat him? And if he's still on that medication, how is it safe for him to return to the White House?
We send patients home with medications all the time. In fact, yesterday afternoon, he probably met most of his discharge requirements safely from the hospital. And he's returning to a facility, the White House Medical Unit, that's staffed 24/7, top-notch physicians, nurses, PAs, logisticians, and the unit here, the team here behind me is going to continue to support us in that nature. Yes?
What infection control measures are you taking? And how was it safe for him to drive around in a cloth mask yesterday? And how is it safe for him now to return to the White House where there have been so many cases? How's any of this safe?
So the president has been surrounded by medical and security staff for days wearing full PPE. And yesterday, the U.S. Secret Service agents were in that same level of PPE for a very short period of time. We've worked with our infectious disease experts to make some recommendations for how to keep everything safe down at the White House for the president and those around him. We're looking at where he's going to be able to carry out his duties, office space, and I'll just say that it's in line with everything we've been doing upstairs for the last several days.
Can you tell us, please, on testing, can you tell us when he had his last negative test? Was it Thursday? Was it Wednesday? When do you remember when he had his last negative test?
I don't want to go backwards.
Contact tracing for people who are around him to know
I
when he
understand
has
the
it?
contact tracing, as I understand it, is being done. I'm not involved with that. So
Was this something he pushed for?
So we try to get patients home and out of the hospital as quickly as is safe and reasonable. Every day a patient stays in the hospital unnecessarily is a risk to themselves. And right now, there's nothing that's being done upstairs here that we can't safely conduct down home.
That 7 to 10 days was a window that you'd be concerned about. I don't think we're there yet. So do you have concerns about potential worsening or reversal? And what are your plans for addressing that if it were to happen?
You're absolutely right. And that's why we all remain cautiously optimistic and on guard because we're in a bit of uncharted territory when it comes to a patient that received the therapies he has so early in the course. So we're looking to this weekend. If we can get through to Monday with him remaining the same or improving, better yet, then we will all take that final deep sigh relief. But as I said, 24/7 world-class medical care surrounding him down there. We're not going to miss anything that we would have caught up here.
Physically going to be in the White House, and what does that look like? How do you keep him safely quarantined?
I wish I could go into that more, but I just can't.
When did you begin dexamethasone treatment?
So that has something to do. Yesterday we talked about that, the several little temporary drops in his oxygen, and we had discussed that as a team and elected to start it early in case that persisted or worsened. The potential risks and side effects we all discussed. We looked at the data and decided that we'd rather, push ahead on it than hold and risk, the opposite.
What about CT scans and chest X-rays? What have you seen on his
campaigning?
As far as travel goes, we'll see.
His mental status, can you talk about whether he has any neurological symptoms? Does he have any side effects from his medications? Any fogginess from the virus?
No, I think you've seen the videos and now the tweets, and you'll see him shortly. He's back. Yeah.
Pneumonia or any inflammation in his lungs at all?
So we've done routine standard imaging. I'm just not at liberty to discuss.
Doctor,
So
you
you're,
were on
so
board
you're
Air Force
actively
One.
not telling us what those lung scans showed, just to be clear.
So there are HIPAA rules and regulations that restrict me in sharing certain things for his safety and his own health and reasons.
Share how many times, you said his oxygen dropped several times. Can you share how many times he was on oxygen? You said you
We
checked with the nursing staff yesterday?
yes. So he the 2 episodes like we talked about yesterday, and both times that he received a little bit of oxygen and recovered immediately.
Was that oxygen required?
No, it wasn't required. He wasn't short of breath. He wasn't looking ill. It was more of us trying to anticipate needs and see how he'd respond. And in both cases, it came right off. He didn't need it from very long at all.
You were on board Air Force One for multiple trips. Are you at all concerned about your own exposure and exposure to the medical team?
I am concerned, but as the CDC says, there are caveats for essential employees that as long as you continue to test negative, you remain symptom-free, and you keep a mask on when you're out and about, which we do inside the hospital 24/7, then you can carry on your duties. Yeah.
Oh, the president's an impatient man. Has he been itchy to get out of here?
the president has been a phenomenal patient during his stay here. And he's been working hand in glove with us and the team. And today got to the point he's holding court with those of us around him, the whole team, going over all the specifics, the testing, what the future is. And we have been back and forth on what's safe and what's reasonable. And he has never once pushed us to do anything that was beyond safe and reasonable practice that we all first wanted.
Medical team who recommended against the president leaving here and going back to the White House today.
Um, no.
The president said, "Don't be afraid of COVID." Do you agree with that? Should we not be afraid?
I'm not going to get into what the president says.
His heart, liver, and kidney function was normal or improving. Improving, does that mean that there were effects, and is it all normal? Like, what's up with that?
Yeah, it's all normal right now. I would say he appeared to be a little dehydrated Friday. He was able to just drink and recover from that. And yeah, everything looks great.
Campaigning out in the country, what sort of things do you?
Yeah, so the big first thing that we need to do is that there is no evidence of live virus still present that he could possibly transmit to others. And that's what the infectious disease experts and some of our partners, military civilian entities, doing some of these advanced diagnostics just to see as soon as we can identify that. Routinely, we talk about a 10-day window, CDC guidelines, but we're checking him more routinely than just waiting 10 days. There's a possibility it's earlier than that. There's a chance that it's a little bit later, but we will know as soon as possible. And then we will look at him clinically. How are you feeling? How are you doing?
Why have you decided not to administer hydroxychloroquine to the president during his time here?
I'm not going to go into all of our debates about specific medicines and therapies. There are dozens of therapies that we were made aware of, that we considered, that we discussed and debated and looked at, the existing literature on. And this is the regimen we chose. Yeah.
Hydroxychloroquine.
In terms of COVID, is he having some of the muscle aches? Has he lost his sense of taste and smell?
No, we were just talking about that, what symptoms he has left. And he's even the slight cough that he used to have, he doesn't really complain of at all. He hasn't ever complained of muscle aches. Yeah, he's up and back to his old self predominantly.
Next Monday, just to be clear, how long will he still be actively shedding the virus?
So this morning, I believe there was even an accounting by Dr. Fauci referencing the first 5 days of illness that people are most likely to shed live virus. There's a reason there's the 10 days is because most people by that time, after 7 days, most folks don't have culturable live virus. They put it to 10 just to give some extra space. It's never 100%, between everybody. So we'll see. I'm not going to put a specific number, but we look at that window is all I say.
Will the president be confined to his residence, or will he be allowed to return to the Oval Office?
We're going to do whatever it takes for the president to safely conduct business wherever it is he needs to do within the residence and White House.
And is he on blood thinners? And also, have you been giving him Tylenol, Advil, anything
Oh,
to
that
bring
came
his
up.
fever
I would
down?
like to say he has not been on any fever reducing medications for over 72 hours. Yeah, he's on a routine regimen of COVID therapy. I'm not going to go into specifics as to what he is and is not on, but
This here that the president had a mild cough, some nasal congestion, and fatigue on Thursday. Now, back to my colleague Jen Jacobs' question. The reason knowing when the president's last negative test is important. For that reason, your words, what you said, and also for the contact tracing. But would you recommend it that, given those symptoms, that the president go to that Bedminster fundraiser?
it's not up to me necessarily, the president's schedule, but I would say that it wasn't until after he returned that we really sat down, then knowing the news of the day, that we really dove into how are you feeling, what's going on.
Those were the symptoms he was experiencing on Thursday.
I'm not going to get into operations.
When was his last negative test and what was his viral load?
I know everyone wants that. Yeah,
Sure.
I don't have his viral load. Those are some of the diagnostics that we're sending out that will really tell us when it's safe for him to get back out and around people.
The last negative test
Did he
was.
have any abnormal tests? Were any of his lab tests abnormal?
I'm not, again, HIPAA kind of precludes me from going into too much depth and things that, that I'm not at liberty or doesn't wish to be discussed. At some future point, maybe, but today, sorry. I think that's it. Yeah. Thank you.
Thank you.
Thank you.